Hey everyone, welcome back to Jerry Academy. I wanted to break down an important and unrecognized cause of dementia today, sleep apnea. I created a YouTube short, which I thought was helpful, but I thought I should elaborate on the YouTube short. If you need more information on aging related topics from a board certified geriatrician, board certified lifestyle expert, board certified family physician, check out jerryacademy.com. The information on the site is totally free and subscribe to my channel. But sleep apnea. So this condition is far more common than most people realize and can be profound, have a profound impact on the brain over time. About 30% of Americans have sleep apnea, and many of them don't even know it. And so this means that millions of people may be experiencing night after night of oxygen deprivation and disrupted sleep without treatment. So the specific type of sleep apnea I wanted to focus on is obstructive sleep apnea, when the muscles in the back of the throat collapse during sleep, blocking airflow. The brain detects this drop in oxygen and briefly wakes you up to reopen the airway. These, we call them microarousals, might last just a few seconds, but they can happen dozens to hundreds of times at night. And that's why people are often tired and sleepy during the day. If you imagine waking up so many times briefly in the middle of the night, you're not even recognizing it. And so, what I wanted to share something that I had created. Let's see if I can do that. I tried to create this video on on Zoom because I wanted to share a slide which I created when I was presenting a lecture. All right, here we go. Okay, so the first part of the slide, so hypoxia leads to oxidative stress plus cardiovascular risk. Again, I created this slide mainly as a part of a lecture that I was presenting, but sleep apnea is a modifiable risk factor for dementia. However, it increases the risk of other modifiable risk factors even more. And low oxygen levels, trigger something we call oxidative stress. And this is kind of an internal rusting that damages brain cells and blood vessels over time. Can increase the risk of depression, hypertension, and vasoconstriction. Vasoconstriction is when those blood vessels get smaller. And when the volume gets smaller, pressures increase, causing high blood pressure. I learned that in physics in undergrad, and it has stayed with me, but increases heart disease, stroke, diabetes, and even obesity. Just remember, these conditions are independent risk factors for dementia, and sleep apnea increases the risk of them all. We have sleep fragmentation, which increases or the reduction in REM sleep plus slow wave sleep. And so what causes sleep fragmentation? You're constantly being pulled out of deep restorative stages of sleep without even realizing it. And reduced REM sleep, this is critical for memory and emotional processing. Oftentimes, patients with dementia, especially Alzheimer's type dementia, have some trouble with emotional processing, regulating their moods. And people with less sleep have the same problem too. And reduce slow wave sleep. So that's the deepest stage of sleep when the brain's cleaning system like kicks in. During that slow wave sleep, where our body is clearing like toxic waste, like beta amyloid and tau protein. And these are proteins that are closely linked to Alzheimer's disease. I sort of think of it like, these proteins just build up. Like think about a dirty, dirty house or hoarder's house where you can barely move through and get from one place to the other. This is what starts to happen to your brain. You don't process efficiently and properly. So pressure changes increase lead to impaired brain fluid exchange and repeated apneic episodes. So, apneic is episodes where you're not getting enough oxygen, creates pressure fluctuations in the chest and the brain. This disrupts cerebrospinal fluid. That's the fluid that's in your brain and your spinal cord. And it makes it harder for the brain to clear debris. Again, including that amyloid and tau protein. So, this Alzheimer's connection, multiple studies now show that people with untreated sleep apnea have increased beta amyloid production, decreased amyloid clearance, increased tau phosphorylation, which accelerates tangle formation in the Alzheimer's process. So think about like a house full of cobwebs. That's how I picture it. And then these biological changes are the same ones we see in the brains of people with Alzheimer's disease. So years before symptoms even appear. So when you put it all together, low oxygen, fragmented sleep, disrupted brain fluid clearance, and increased neurotoxic proteins, it's no surprise that sleep apnea is a major contributor to cognitive decline and dementia. What's powerful about this is sleep apnea is a modifiable risk factor. That means it's something we can screen for, diagnose, and treat, potentially reducing dementia risk and improving quality of life. So, what can you do? If your loved one snores loudly, feels exhausted during the day, has been told you stop breathing at night, if you're an elder, if you're a man, if you struggle with obesity, these are all risk factors for sleep apnea. It's worth talking to your doctor. A simple sleep study can make all the difference. And then treatments like CPAP, positional therapy, or dental devices can restore normal sleep, protect your heart and your brain, and improve your energy, mood, and your memory. Sleep isn't just rest, it's restoration. And in the case of sleep apnea, restoring your sleep could help protect your brain for years to come. So, if you found this video helpful, please subscribe to Geri Academy and check out other videos on brain health. Subscribe to my channel.